Knock, knock. Hi guys, I'm Harvard Dermatologist Dr. Abby Waldman, and today I am going to do microneedling at home on me. If you have ever been curious about microneedling and whether it can help your skin, this video is for you. I'm going to go over what to look for in an at-home microneedling device and how to use it safely, including what you can put on your skin right afterwards and what things you should avoid. And then stay tuned to the end because I'm going to go through step by step on how to use at-home microneedling. So who can benefit from at-home microneedling? So microneedling works for many different skin conditions. It works for melasma, brown spots, hyperpigmentation. It works for alopecia, for hair loss. It works for skin remodeling, reducing wrinkles, just rejuvenating the skin and reducing pore size appearance. It can also improve stretch marks. So how does microneedling help with so many different conditions? So I made this lovely diagram here. Hopefully you can read it because it is very true that doctors' handwriting is awful. I'm definitely a testament to that. So this is our skin. We have an epidermis or dermis. There are little fibroblasts in the dermis that make collagen and respond to growth factors. They also release growth factors to turn over the skin to make new, beautiful skin. The hair follicle right at the bottom is actually where skin stem cells live and where they make new skin cells essentially to fill in any holes or injuries and replenish the skin every few days or every week plus. What microneedling does is similar to fractionated laser or other types of procedures by putting little holes into the epidermis and even to the dermis a little bit below, depending on how deep it's penetrating. Most at-home microneedling devices just go through the epidermis. They're less than 2 millimeters. The epidermis is anywhere from 0.5 millimeters thick to 1.5 millimeters thick on your palms. So essentially what happens after microneedling makes these little injuries, it signals everything around it to fix it. Basically, it says there's a little hole in the skin and you need to fix it. And what that does is it turns on the mechanism for making new skin cells, turning over old cells, making new collagen. And so that helps with wrinkles, it helps with hyperpigmentation, and that's how you get all these stimulatory effects. It also creates these little micro holes that allow things from the outside to come in and penetrate a little bit easier. That can be a good thing or a bad thing depending on what you put on your skin, hence why we'll talk about what you should and shouldn't put on your skin after you do microneedling. So really, microneedling is kind of like exercise. Basically, you have these little injuries to the muscle that get repaired and then you're stronger the next day. That's what microneedling is in a nutshell. It's exercise for your skin. So which type of at-home microneedling device should you get? Basically, there are really two types. One is a roller and one is a pen or a stamping device. Stamping devices and pens are better. They simulate what is done in the office, and there's just more control about the depth of penetration that you're getting with that device. It also just tends not to tear the skin, whereas the derma rollers will tear the skin as they're going over the skin. They also can actually buzz the hair if you're using it for alopecia and kind of trim your hairs, which you might not want. The needles come in 0.5 to 2 millimeters. I really recommend starting with 0.5. It's a lot safer and you're still gonna get a really good effect at home with the 0.5 millimeter needle length. If you do it in the office, you are going to have longer needles, and so you are gonna get a deeper penetration that's gonna go into the dermis for the most part. Now that is going to give you more of an effect. You're going to get a faster result if you do in-office microneedling than at home microneedling. So you really just have to sort of consider what type of result you're looking for and how fast you're looking to get it. But that 0.5 millimeter needle length is really going to be both safe and effective. So the first step is taking off makeup. You want to use a makeup remover. I'm going to leave my eye makeup on if that's all right. And then you're gonna follow that just with a gentle cleanser. And I'm gonna do my neck too, because I'm gonna treat my neck. Okay, we are ready to go and do at-home microneedling. Okay, so now my skin is clean. So the microneedling device I use is one by Banish. It's called the Banisher 2.0. It comes like this in this little sterile sleeve. You are going to have to get your own isopropyl alcohol, which is available for like $1 or $2 at CVS, Walgreens. This one's from CVS. And you're gonna need the alcohol in order to sanitize the device. And so it comes like this. You open your little guy. And here's what it looks like. There's these little teeny tiny gold needles. And in order to sterilize it, you're gonna put some isopropyl alcohol in the cap. And then it fits right in here if I don't get it everywhere. Then you can leave your device there. You can have that isopropyl alcohol to put the microneedling device in whenever you're not using it. Then you can take it out and let it dry just so it doesn't irritate the skin. Again, on clean skin. So the needles on the Banisher 2.0 are finer and thinner than other needles on home microneedling devices. I have not found that you need any numbing medication. Certainly if you're in the office, you do need numbing medicine because those needles are longer. So again, these are only going 0.5. That's basically like the depth of your epidermis in the eyelid area. So these are not even going all the way through the epidermis to the dermis. So pain is minimal. You know, I guess I do have a high pain threshold, but I don't find it to be particularly painful. You know, maybe the upper lip is like a little tender. So if you see here, this little pinpoint bleeding is what you're looking for. It should look really red and like a little bit of blood. That means you're good. That means you're getting the effect that you want. And you basically move just like a few millimeters along your skin and it's going straight in and straight up. It's really pretty easy and straightforward. I'm gonna go try not to cover the same areas you already went into, but it should be pretty obvious because you can see where you went. You do want to be careful around the eyes. You know, certainly I'll sometimes do like this area right here up in the crow's feet, but I tend to kind of try to avoid the under eye, especially until you know really how you're going to react to it. If you do find you need numbing medicine, then certainly like an over-the-counter lidocaine is sufficient. You usually don't need like the EMLA that you would need if you were going to do this in office. So how often can you do this? So it kind of depends on what you're looking for. If you have acne scars, especially deeper or hyperpigmented acne scars, you can do this once a week if your skin has recovered. I do it once every month. Generally, you know, again, I'm looking for skin resurfacing, reducing wrinkles and hyperpigmentation. So I find that like once a month is good. And I've been doing it for about the last 5 months or so. The reason I like it is it's something I can do at home. Certainly certain like fractionated lasers and in-office microneedling are gonna give you results faster, but again, they're gonna be more expensive. There's gonna be more downtime. You have to go into the office. It requires usually, you know, several visits. And I find that, like, especially for what I'm looking for, that's not worth the hassle, I should say. And you can certainly do it in conjunction with those professional treatments. So if you're getting in-office microneedling, you know, you don't want to do it probably within a month of that, but certainly you can do it in addition if it's outside of that month. In terms of like ablative laser, you might want to check with your physician because with ablative laser, you have a lot more downtime afterwards. And so you really don't want to introduce any other injury to the skin for quite a while. The side effects, you're kind of seeing them. Basically, you're going to look a little red, a little irritated. It generally goes away in like an hour. And then by the end of the day, your skin almost looks normal depending on what time you do it. I mean, it definitely still looks like a little red, a little irritated, but not this like hot red, you know, pinpoint bleeding. I have a dinner I'm gonna go to tonight and I'm sure like I'll look a little red, but yeah. So again, you're looking for that pinpoint bleeding. I'm gonna go a little bit closer so that you can see it. And that's your endpoint. So how would you use this for alopecia? Same thing. You know, basically you would just show the little areas and you would, you know, put it right there. I didn't prep that area of my scalp. I didn't, you know, you would want to make sure you do it on like clean hair, clean scalp. You don't want to introduce anything from the outside, right? Because like we talked about, these little tiny holes make it easier for good things to go in, but also bad things. And especially when it's longer needles, those definitely increase the risk of these foreign body granulomas where things that shouldn't have gotten in, got in, and your body kind of walls them off. With these short needles, you know, again, you can never be 100% sure, but it's a safe because it's not going through the whole epidermis. And I am going to do that little area here, right in my crow's feet. I'm careful not to get too close to the eye. The only part that's a little spicy is the upper lip, at least for me.
talk while I'm doing it. And it's like just spicy enough to like wake you up. Whew. And you can do your forehead too. I'm actually gonna skip down to my neck because that's more of the area I want to treat. And remember, I washed my neck as well. So what can you apply after microneedling? The best things to apply right afterwards are serums where the ingredients don't get in so easily. So vitamin C is one of those. Hyaluronic acid is also one of those. It just has a hard time penetrating through the outer epidermis for various reasons. And so applying your serum right afterwards can help quite a bit. Otherwise, I would use really gentle skincare. If you're gonna put on a moisturizer at all, like it should be really like a gentle, fragrance-free, nothing fancy. I would not put any retinoids on. I would not put anything with alcohol in it because it is gonna burn. Same with the retinoid. The retinoid's not gonna necessarily do anything bad, it's just gonna hurt. You really want to be careful about getting any sun afterwards because again, that skin is like in its most vulnerable time and it needs to recover. So you really need to be good about like no sun. Ideally just like avoid the sun or wear a hat or protective clothing. And then, if you're gonna put on sunscreen, I would put on a mineral sunscreen. Again, just because like whatever you're putting on your skin is getting a little deeper in your skin than what it normally does. Look at that, they look beautiful. Unlike some professional procedures, you're not gonna get like as much crusting like several days after. I have gotten procedures that go like a little bit deeper, like fractionated laser. You do notice like a little more kind of like scaling a few days after than you do with this. Again, because this is just not going as deep. Are there any areas you can't treat? I don't know, not really. I guess just again, like be careful around the eyelid skin. With this length needle, that 0.5, that's probably the only area you like could get in trouble with scarring, I think. I think if you do it on like the palms or soles, you probably aren't gonna notice much of a difference. Or same, you might notice a difference on the back, but again, that epidermis is much thicker. So you're gonna just see less of a difference. Other things that you can consider putting on afterwards, for hair loss, anything that you put on after the doing the microneedling is going to get in easier and penetrate better. So minoxidil is one of those, Rogaine, essentially finasteride if you have it. All of those are going to penetrate and cause an improvement in your hair loss by doing it that way. Of course, minoxidil can burn. It has often alcohol in it, so just be aware of that. Like, you might even want to wait like a few hours before putting it on, but not so long that the little holes have started to close. And then what do you want to avoid? Again, you just want to avoid anything that you're like worried about it getting into the skin. Again, it's not going down the dermis, but these are like little holes. So you want to make sure you're keeping your skin clean. You're cleaning it at night. You don't want to get any bacteria. You really want to prevent any infection by just washing, showering, things like that. Makeup I would avoid for the day. I mean, I think it's fine to do like your eye makeup if you're not treating your eyes and lipstick and things like that. That's probably fine. Oh, can you do your lips? Again, the lip skin is very thin, a little bit easier to get in trouble with like complications on your lips, similar to your eyelids. Okay, that's pretty good. You can see everywhere I treat it, right? Around the mouth, on the cheeks, nose, kind of skip that area around the eye. Did my forehead. I think we're good. So now I'm going to re-sterilize this by putting it back in my little alcohol holder. So again, I really like the Banisher 2.0 because it has those really fine, sterile needles. I feel like it's really safe. It only goes in 0.5 millimeters. I feel like it's safe, it's effective. I'm gonna put my vitamin C serum. This is actually from Banish, but I've used all sorts of vitamin C serums, so you can put it on. And I usually put that on right after. A little stingy, not too bad. And again, I'm just gonna avoid going out. Here's a picture of another time that I did it, and that just later that night, maybe like 6 or 8 hours later, and then a picture of me just the next day. So sort of what you can expect. So it really gets better pretty fast. So again, that vitamin C serum helps with pigmentation, helps with wrinkles as well, and this gets it sort of penetrated into the skin. So hopefully that was helpful. I'm Dr. Abby Waldman. Be well.